Hello everyone, my name is Dr. Shehzad Saeedullah and I am a head and neck and anterior skull-based surgeon. Welcome to my YouTube channel where we take complex ideas and break them down into simplified forms for all the doctors to understand. So if that is of interest to you, please hit the like and subscribe button and hit the bell icon so that you get all the notifications from the page. So without further delay, let's get into today's video. Today we are going to be performing the examination of the nose and the paranasal sinuses. So as a part of any examination, first we have to do 5 basic steps, which are introduction, consent, exposure, position and a light source. So let us start. अस्सलाम वालेकुम जी, मेरा नाम डॉक्टर शहजाद सैदुल्ला है। मैं यहाँ पे ईएनटी का माहिर डॉक्टर हूँ और आज मैं आपकी नाक का मुआयना करूँगा। दौरान मुआयना आपको किसी किस्म की कोई तकलीफ नहीं होगी। अगर आपको कोई भी तकलीफ हो तो आप मुझे बता सकते हैं। आपकी इजाज़त है? So this is introduction and consent. Now comes the exposure. Anything that does not belong to the patient, you have to take them off. Now the patient is wearing spectacles, so let us ask him to remove them. आप अपनी एनके उतार सकते हैं? जी सर। ठीक है। Thank you. Now comes your position. Again, you should be sitting at the level of the patient and about 1 arm length away. And the most important bit of all, you need a light source. So you need to take a headlight, put it on, and focus it on the place that you want to examine. Again, examination of any structure involves 4 basic steps, which are inspection, palpation, percussion, and auscultation. In ENT, it is mainly the inspection and palpation that we focus on. So let us start with inspection of nose. So you have to inspect the nose in 7 different planes. Number 1, this is the frontal. Number 2, आप सर थोड़ा सा नीचे करें. You have to look it from the top, which is called the bird's eye view. आप सर थोड़ा सा ऊपर करें. You have to look it from the bottom, which is the worm's eye view. आप मेरे इस हाथ की तरफ देखें. This is right oblique. आप सर पूरी तरफ उस तरफ मोड़ें. This is right lateral. The same way, आप मेरे इस हाथ को देखें. This is left oblique. आप सर उस तरफ मोड़ें. And this is left lateral. On inspection, you will notice anything that seems unusual to you. It may be in the form of deviation, a hump, nasal asymmetry, any fracture, any swelling, anything that you note, you comment on. After inspection of nose comes your palpation. So you start by palpating the sinuses. And before starting palpation, you have to tell the patient that if there is any place tender, he should let us know. आपको कहीं भी दर्द महसूस हो तो आपने मुझे बताना है, ठीक है? Now you again turn on the light. You start by palpating the frontal sinus. You don't palpate them at the same time because then you wouldn't know which sinus is tender. Then you will palpate for the ethmoids and then you will palpate for the maxillary sinuses. And at the same time, you are looking at the facial expressions as to whether the patient is grimacing. If he is grimacing, it means that that sinus is tender. After palpating the sinuses, you will palpate the nasal bridge and the nasal dorsum to look for any asymmetry, any swellings, anything that you can feel, you comment on. After inspecting and palpating the nose and also palpating the sinuses comes your assessment of the nasal airway. So for that, you take a metallic spatula and you ask the patient to breathe gently through the nose. नाक के जरिए आप आराम से सांस लें. And you look at the misting to see whether the misting is equal or if one is misting more. Another way that you can test the nasal patency is by taking a cotton swab. You cut it small and then what you do is you will obstruct one of the nostril and ask them to breathe through the nose. नाक से सांस लें. So if the cotton swab is moving, it means that the nose is patent. That side is patent. Again with the other nostril, नाक से सांस लें. So this shows that the nasal patency is normal. After assessing the nasal patency, we are going to do anterior rhinoscopy. So in order to do anterior rhinoscopy, we take a Killian nasal spectrum. The way that we hold it is like this, right? We will stabilize the head with our non-dominant hand, lift the head up, and gently introduce it inside the nose and have a look as to the structures that you can see. So you will look at the roof. For that, you have to look up. You need to look at the floor. For that, you need to tilt the head down. You need to look at the medial wall, the septum, and the lateral wall. Then again, you repeat the step on the other nostril, gently introduce it, open it up, and have a look. If during this step, if you see any secretions building up inside the nose, so what you will do is you will take a cotton swab and gently clear off the secretions. So in order to do that, I have to hold the speculum in my non-dominant hand, and with my dominant hand, I'm going to be cleaning off any secretions or any discharge so that I can have a good view inside the nose. After doing the anterior rhinoscopy, we are going to assess the smell of the patient. So for that, you need to have a scent. You ask the patient to close eyes. आपने अपनी आंखें बंद करनी है और मैं आपको एक स्मेल आप महसूस करेंगे. आपने मुझे बताना है कि वो अच्छी स्मेल है या बुरी स्मेल है, और आपने ये भी बताना है कि दोनों नतों में आप एक जैसा महसूस कर सकते हैं या किसी नते में कम या ज़्यादा महसूस कर रहे हैं. आप अपनी आंखें बंद करें. Then you will open up the scent. You will block one nostril and you ask the patient to sniff. आप नाक से सांस लें. किस किस्म की स्मेल है? इस नाक से सांस लें. कैसी स्मेल महसूस कर रहे हैं? कौन सी वाली में ज़्यादा आ रहा है? इसमें कम आ रहा है. ठीक. So that is how you are going to assess for smell of the patient. After assessing the smell of the patient, now we need to examine the oral cavity. A part of examination of the nose also involves certain steps in examination of the oral cavity. So for that, first we will pick up a metallic spatula. You need to stabilize the head, but I will not be doing it so that you get a clear view. So you ask the patient to open mouth, मुंह खोलें आप. You gently lift the lips up and you have a look at the teeth, the premolars and molars. In the same way, you will do it on this side, right? You will have a look. One other step that you can add is look for tenderness of the teeth. So what you can do is gently press it against the premolars and molars to see whether there is any tenderness. At the same time, you are looking at the facial expressions as to see whether the patient is grimacing, right? After assessing the teeth, what we are going to do is have a look at the hard palate, because the floor of the nose is formed by hard palate. So we ask him to open mouth, मुंह खोलें. You will have a look as to see whether there is any bulge or any discoloration on the hard palate. And then we also need to assess the sensations on hard palate. For that, we need to educate the patient. आपको मुंह के अंदर अगर कोई चीज़ महसूस हो तो आपने हमें बताना है, ठीक है? मुंह खोलें आप, आंखें बंद करें. ये कौन सी साइड पे आपको महसूस हो रहा है? कौन सी साइड पे? साइड पे. ठीक है, मुंह खोलें आप. ये कौन सी साइड पे महसूस हो रहा है? राइट साइड. ठीक. After assessing the sensations of the hard palate, after assessing the palatal sensations, now we are going to do the posterior rhinoscopy. So for that, you need a posterior rhinoscopy mirror. We are going to heat it at the mirror end. So ideally, we should be using a lighter. You light the match up. You will gently heat it. You will take a swab. Gently clear off any fogging that may have collected. You will first see whether it's too warm to be used on the patient, and then you put it on the patient's hand. जी ये देखें, ये ठंडा है, गर्म नहीं है, ठीक है? Then you will take a metallic tongue depressor, open up the light, मुंह खोलें आप, मुंह खोलें. You will gently depress the tongue and gently introduce the mirror to have a look at the postnasal space. One thing that you should be careful about is not press the posterior pharyngeal wall, or else it is going to elicit gag. After doing the posterior rhinoscopy, the next step is we are going to look for the movements of the soft palate. So for that, you will take a metallic tongue depressor. मुंह खोलें आप, मुंह खोलें. You gently depress the tongue and ask the patient to say ah. Ah करें आप. Say ah. After looking for the movements of the soft palate, now we are going to check the gag. So the way of checking gag reflex is, again, you will take a cotton swab on a Jobson horn probe. You will turn on the light. मुंह खोलें. इस तरफ करें. You will gently depress the tongue and you are gently going to touch the posterior wall with the swab to see whether the gag is elicited. So first on the left side and then on the right side. So the gag in this patient is intact. After that, now we are going to look for the tongue movements, because examination of the hypoglossal nerve is very important in examination of the nose too. आप मुंह खोलें, जुबान बाहर निकालें, जुबान दाएं तरफ ले जाएं, जुबान बाएं तरफ ले जाएं, जुबान ऊपर तालू से लगाएं, ठीक, बंद करें. The next step in examination is assessing the neck lymph nodes. So for that, we stand behind the patient. थोड़ा सा आप इस तरफ मुड़ें, ठीक है. We start off from the midline, assessing level 1A, which is a submental. Then we will go towards 1B, which is submandibular. Then we go for level 2, which is the upper part of sternomastoid. Then we go for level 3, which is the middle part of sternomastoid. Then we go for level 4, which is the lower part of sternomastoid. After that, we will come to the posterior triangle, which is level 5. During that, we will also assess for the post-auricular lymph nodes, right? And then we come in the midline, which is level 6. So this is the way of palpating the neck for the neck lymph nodes. You can also do it with one hand, level 1A, level 1B, upper part of sternomastoid 2, middle part 3, lower part 4. Behind the sternomastoid is level 5, and in the midline is level 6. The same way here, 1A, 1B, 2, 3, 4, 5, and 6. While you are assessing the neck lymph nodes, you also ask the patient to lift the shoulders up. आप जरा दोनों कंधे ऊपर करें इस तरह. Now we are looking for accessory nerve. After checking the accessory nerve, now we need to auscultate the chest of the patient. Auscultation of the chest is an important part of examination of nose. आप लंबी सांस अंदर लें, 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 सांस अंदर लें. The reason that we need to auscultate the chest is because patients with nasal allergies most of the times also have some form of chest allergies too. For the undergrad students, this concludes the examination of nose. But for the postgrad students, there are certain other steps that they need to be doing. So the first thing that the postgrad students need to do after assessing the neck and auscultating the chest is examination of the eyes. So the first thing that they will look at is the telecanthus, which is the distance between the two medial canthi. Second thing, they will be looking at the proptosis to see whether the eye globe is protruding out. After looking for proptosis and looking for telecanthus, the next step is assessing the extraocular movements. So for that, you need to stabilize the head. You need to hold the head with the non-dominant hand. I will not be doing it because I want you to have a clear view. So at one arm length away, give them a fixation point. आपने मेरी इस उंगली के नाखून को देखना है, इसके पीछे आंखें लेके जानी है, ठीक है? So you draw an H to look for the extraocular movements. After looking for the extraocular movements, now we need to check the visual acuity of the patient. So for that, we ask the patient to cover one eye. आप अपनी एक आंख इस पे जरा हाथ रखें और आपने मुझे बताना है कि आपको कितनी उंगलियां दिखाई दे रही हैं, ठीक है? ये कितनी उंगलियां हैं? ये कितनी उंगलियां हैं? ये कितनी उंगलियां हैं? अभी आप दूसरी आंख बंद करें. ये कितनी उंगलियां हैं? ये कितनी हैं? 2. ये कितनी हैं? 3. After checking the visual acuity, we are going to check the visual field of the patient. So for that, you first educate the patient. आप अपनी एक आंख पे हाथ रखें इस तरह. We will also close the eye corresponding to that. And then you will tell them that when they see your finger, they should be telling you. They should be fixating on you, and when they start seeing the finger, they should inform you. आपको जब मेरी उंगली दिखाई दे तो आपने मुझे बताना है. ये सब दिखाई दे रहा है. दिखाई दे रहा है. Now the same with the opposite eye. दूसरी आंख पे हाथ रखें, मेरी तरफ देखें. दिखाई दे रहा है मुझे. दिखाई दे रहा है. After checking the visual field, now we are going to check the color vision. So again, you ask the patient to close one eye. आप एक आंख बंद करें. ये कौन सा कलर है? रेड. ये कौन सा कलर है? ब्लू. दूसरी आंख बंद करें. ये कौन सा कलर है? रेड. ये कौन सा कलर है? ब्लू. So you should have color coding. Ideally, it should be red, blue, and green. That is how you will check the color vision of the patient. After checking the color vision, now we need to assess the pupillary reflexes. So for that, the room should not be highly illuminated. There should be slight darkness. We will take a torch. First, check the light on your hand. We will focus the light but not on the eyes. There are two reflexes that we are going to be checking. One is the direct light reflex and the other one is consensual. So we start shining the light in this eye, checking the pupillary reflexes in this one. This is the direct one. And we will also be looking at the opposite pupil, checking for the consensual reflex in the opposite eye. In the same way, from the right side, shine the light in the right eye. If the pupil constricts, we are looking at direct light reflex in the right eye, and at the same time we are looking at the pupillary constriction in the left eye, which is the consensual light reflex in the left eye. We will be talking more about the interpretation of orbital examination in a separate video, so please make sure to check that out. After the orbital examination, now we are going to assess the facial sensations. We are going to be checking the trigeminal sensations, which are the ophthalmic, maxillary and mandibular. So for that, first we educate the patient. We take a cotton swab. जी आपको ये महसूस हो रहा है?
जी सर।
आपको अपने माथे पे जहाँ पे ये महसूस हो आपने मुझे बताना है, ठीक है? आप आंखें बंद करें एंड देन यू जेंटली स्टार्ट रबिंग इट. कहाँ पे महसूस हो रहा है?
माथे की राइट साइड.
ठीक है. अभी कहाँ पे आंखें बंद करें. अभी कहाँ पे महसूस हो रहा है?
राइट चेहरे पे.
आंखें बंद करें. अभी कहाँ पे महसूस हो रहा है?
लेफ्ट पे. लेफ्ट चेहरे पे.
आंखें बंद करें. अभी महसूस हो रहा है?
नहीं सर.
आंखें बंद रखें. अभी कहाँ पे महसूस हो रहा है?
लेफ्ट.
अभी कहाँ पे महसूस हो रहा है?
माथे की लेफ्ट साइड.
After assessing these, you also need to compare the left with right. अगर आपने मुझे बताना है कि दोनों आपको एक तरह महसूस हो रही है या कोई कम ज़्यादा महसूस हो रहा है. आंखें बंद करें. कहाँ पे महसूस हो रहा है?
दोनों चेहरे पे.
एक जैसा महसूस हो रहा है?
जी सर.
After checking for facial sensations, now we are going to elicit the corneal reflex. So again, the same, we are going to take a cotton swab. We will stabilize the head and first in the left eye, gently touch it to see whether there is blinking, and then in the right eye, gently touch it to see whether it reduces blinking. The last step in examination of nose for the postgrads is otoscopy. So we will take an otoscope, turn it on and have a look inside the ears to look whether the tympanic membrane is retracted. दूसरी तरफ मुड़ें. In the same way, we are going to have a look at the left ear. So this concludes our examination of nose. In the end, you always thank your patient and you cover them back up. जी आपका बहुत शुक्रिया. आप अपनी glasses पहने. Thank you so much. Thank you everyone for watching. If there are any more complex topics that you would want us to cover, please let us know in the comment section. Thank you so much.